Another thing you should be noticing at the very beginning of her argument is that it is a claim of policy. This is really important. In our lessons, we had talked about the different types of claims. There was a claim of fact, a claim of value, and a claim of policy. And if you remember, a claim of policy, the first thing that the author needs to do is establish the problem. The author needs to convince the audience that the problem actually exists. If there isn't a problem, then why do we need a solution, right? So that's the first thing Friedman needs to do, is Friedman needs to convince her audience that a problem exists. The next thing she'll need to do is she'll need to present her solution and convince her audience that her solution is ethical, viable, that it'll work, and it's the best possible solution. And in my opinion, Friedman does a pretty good job with both of these things. And she sets up her claim of policy appropriately because she does start with the problem. So the very first paragraph, actually the first two paragraphs, set up the problem. If you look at the first paragraph, she says the demand for life-saving organ transplantation has so outpaced supply that waiting patients and transplant teams are desperate. Improved survival rates coupled with steady expansion of indications for transplantation make the organ shortage progressively severe. Waiting times are now unbearably long. Okay, so she's telling us that they need more organs, that the demand has outpaced the supply, that it is getting progressively severe. Not that it's just severe, not that it's ongoing, but progressively, which means exponentially, it's getting worse and worse and worse. She uses some great word choice in here as well. If you take a look when she says that transplant teams are desperate, you know, she could say that transplant teams are in great need, but instead she uses the term desperate. She paints a very vivid picture. She continues with the words progressively severe. Severe helps to make the audience realize not just the severity, but how important it is, how we need to do this quickly. And that waiting times are now unbearably long. And she's talking about, obviously, for the patient, it's unbearably long. Not that it's very long, not that it's too long, but unbearably, where they can't take it anymore, obviously because they need the organ in order to survive. So she's starting her argument out, establishing the problem, using great word choice in order to paint a very clear picture and slightly emotional picture of how severe the situation is, how important the situation is, and that it needs to be taken care of immediately. When you continue to go on, the second paragraph says, lack of donors has led to some patients contracting with organ brokers to purchase a kidney from a living donor. Because payment for organs is illegal in most countries, people may travel to the donor's homeland for the transplantation. Limited studies indicate possible exploitation of these paid donors, who may get minimal benefit from their purported financial compensation. More worrisome is our lack of knowledge about adverse outcomes they experience. Okay, so she's saying not only do we need the organs because there are people who desperately need them, but she's also saying that because of the shortage, people are going to countries where they can purchase an organ, and that many of the people who are, or at least she's implying, that many of the people who actually sell their organs are being taken advantage of, that they're being exploited. So she's saying there's multiple problems here, and that her solution is going to, of course, fix all of these problems. Now there's one more problem, and she's going to talk about that next. But before we get there, I also want you to pay attention to something that's going on in that second paragraph. She says, limited studies indicate possible exploitation. And that is also a use of ethos. And you may think, how is that ethos? Because she's being incredibly honest. She doesn't have to say that they're limited studies. She could just say studies. By saying limited, she's being very honest about the situation, which helps us to trust her more. Additionally, she says limited studies indicate possible exploitation. So she's not saying that some studies show that exploitation probably takes place. No, she's saying limited studies indicate possible exploitation. So she's saying she's not sure, it's not for certain that the exploitation is taking place, but most likely it is. The great thing here is that she's being very honest, which scores points with her audience, right? We trust her more. But she's still giving us that idea that these people are being exploited. It's sort of like if you've ever watched a courtroom drama and one of the lawyers will say something to the jury and then the judge will say, oh no, you have to strike that and disregard what the lawyer just said. But it doesn't matter because it's already been said and it's already in the jury's head, right? Same thing here. Even though she's saying the studies are limited, it only indicates possible exploitation. That idea, especially coupled with the picture that's right next to it, puts that in our head that these people are being exploited.